Radium-223 is a first approved radiopharmaceutical, and it's approved for the treatment of metastatic prostate cancer with bone metastasis, symptomatic bone metastasis, with no visceral metastasis. And that was based on a study called the ALSYMPCA study, about 600 patients, that showed a survival benefit of about 3.6 months and a hazard ratio of 0.7, and a delay to the time of first skeletal-related event of about 5.8 months. That was the standard dosing of that drug is given, was called 50 kilobecquerels per kilogram monthly for 6 times. So that's how it's approved to give. So there were a lot of questions that were left unanswered though after the ALSYMPCA study of, well, should we give it at a higher dose? Should we give it for longer than 6 treatments? Should we give it in different combinations? Should a visceral metastasis be allowed? So this study with the retreatment of 6 was to try to answer one of those, to say, is there a benefit of going beyond 6 to 12 doses? So retreatment with 6 additional doses of radium-223 in men with metastatic prostate cancer with metastasis to the bone that are symptomatic. In this study, there was only one patient that had confirmed radiographic progression during the additional 6 doses. So if we look at this and say, is it tolerated? Yes, I'd say the answer to that based on this small study of 44 is that it seems to be tolerated giving an additional 6. The second question would be, is there therapeutic benefit of getting the additional 6? And that's a small study looking at that, but we haven't answered that. And there are additional studies ongoing of looking at it in different combinations, again adding the ability to give it during visceral metastasis, and also a higher dose. So Bayer is sponsoring a 3-arm study where patients are assigned to the standard 50 kilobecquerels per kilogram every month for 6 doses, or a higher dose of 80 kilobecquerels per kilogram for 6 doses, or the 50 kilobecquerels per kilogram for the 12 doses. So patients are randomized to one of those 3 arms. So this will help give additional information for this topic.